Firstly, let's know some basic concept about diuretics. Diuretics are substances that increase production of urine. Most diuretics act to increase excretion of sodium, which is followed by water, because increased urine production results in reduced blood volume. Diuretics are commonly used to treat primary hypertension and edema, changes in body fluid and electrolytes imbalance. But diuretics can also be therapeutic for some other conditions. Now, the basic unit of the kidney is called a nephron, and each nephron is made up of glomerulus, which filter the blood. The filtered content then goes through the renal tubule, where excess waste and molecules such as ions and water are removed for filtered through an exchanger between the tubule and pertubular capillaries. So, the renal tubule plays a huge role in secretion and reabsorption of fluid and ions, such as sodium, potassium, and chloride, in order to maintain hemostasis or the balance of fluid and ions in our body. The renal tubule has few segments of its own. The proximal convoluted tubule, the U-shaped loop of Henle with a thin descending and a thin ascending limb and a thick ascending limb. And finally, the distal convoluted tubule, which empties into the collecting duct, which collect the urine. So let's now move on to the next slide, which is about different types of diuretics. The classification of the diuretics are 5 types. 1. Carbonic anhydrase inhibitors. 2. Osmotic diuretics. 3. Thiazide and thiazide-like diuretics. 4. Potassium-sparing diuretics. 5. Loop diuretics. Now mainly we will now talk about 3 diuretics: osmotic diuretics, carbonic anhydrase inhibitors, and loop diuretics. So first of all, we will talk about the osmotic diuretics. Osmotic diuretics which work by interfering directly with osmosis. As we know from basic biology, water has tendency to move across membrane from a lower osmolarity or the dilute side to a higher osmolarity or the concentrated side. So these osmotic agents are filtered from glomerulus. They are a very water soluble or hydraulic, and they undergo the limited reabsorption due to their large molecular size. This leads to increased osmolarity of the tubular fluid and thus decreased water reabsorption. Now, because osmotic diuretics increase water excretion rather than sodium excretion, they are not very effective for treating edema caused by sodium reaction. Instead, they are mainly used for reduction of intracranial pressure, promotions of urinary excretion of toxic substance, as well as promotion of urine production in patients with acute kidney failure. Example of osmotic diuretics are mannitol and urea. Now, the uses of the osmotic diuretics. The drugs are highly choiced because they are non-toxic, fully filtered, non-reabsorbable, and non-metabolized. They are administered prophylatically for the acute renal failure secondary to trauma of cardiovascular diseases, surgery, or nephrotoxic drugs. Side effects of the osmotic diuretics. They increase the extracellular fluid volume, and also they are responsible for cardiac failure. They also produce headache, nausea, or vomiting. So now we will talk about carbonic anhydrase inhibitors. Basically, carbonic anhydrase inhibitor produce their diuretic effect mainly by reducing reabsorption of bicarbonate in the proximal convoluted tubule. Now let's zoom in on the epithelial cell of the proximal tubule to see how they exactly do that. So to the left of the epithelial cell, we have lumen where urine is being formed, and to the right we have interstitium which contains blood vessels. Now here bicarbonate reabsorption is initiated by the action of sodium hydrogen ion exchanger, which allows sodium to enter the cell in exchange of hydrogen ion. Next, reabsorbed sodium is pumped by sodium potassium ATP phase out of the cell, where the secreted hydrogen ion combines with the luminal bicarbonate ion to form carbonic acid. Carbonic acid is then rapidly dehydrated to carbon dioxide and water by an enzyme carbonic anhydrase. Now, carbon dioxide enters the epithelial cell by simple diffusion and gets rehydrated back to carbonic acid by intercellular carbonic anhydrase. Finally, intercellular carbonic acid dissociates to form hydrogen ion, which can be transferred by the sodium hydrogen exchanger to the lumen, and bicarbonate ion, which is transported out of the cell. Now, when carbonic anhydrase inhibitors come to around, it inhibits carbonic anhydrase enzymes, and as a result, bicarbonate gets retained in the lumen. Since bicarbonate reabsorption utilizes the sodium hydrogen exchange inhibition of carbonic anhydrase leads to significant reduction in proximal tubule sodium reabsorption, which ultimately results in mild diuresis. Now, the reason why the diuretic effects is only mild is because the majority of the sodium that doesn't get reabsorbed in proximal tubule still gets reabsorbed by distal parts of the nephron. However, this is late reabsorption also leads to increased potassium secretion, which is one of the side effects associated with the class. Now, one of the most popular drugs that belongs to this class is acetozolamide. However, due to its relatively weak diuretic effect, acetozolamide is commonly used for other pharmacological actions. So let's talk about some uses. These are used to treat chronic open-angle glaucoma, aqueous humor as high bicarbonate, and they are also acute motions, sickness prevention and treatment. The side effects, they are the rapid tolerance and they increase bicarbonate excretion causes in metabolic acidosis. Let's move on to the loop diuretics. So loop diuretics, just like their name suggests, work in the loop of Henle, specifically in the extending limb where they inhibit sodium potassium 2 chloride conceptors. Out of all diuretics, these agents produce the greatest diuretic effect because as much as 25% of sodium gets reabsorbed in the ascending limb. And at this point, other parts of the nephron can no longer compensate for increased levels of tubular sodium. So now let's zoom in on the cell. So the thick ascending limb to see what exactly happened there. So upon reaching the thick ascending limb, some of the filtered sodium potassium and chloride get reabsorbed by sodium potassium 2 chloride conceptor. This, among other things, leads to accumulation of potassium within this cell. However, potassium also tends to leak out through potassium channels back into the lumen, which contributes to a more positive charge there. Now this positive in the lumen produces electrical driving force for particellular reabsorption of cations such as magnesium and calcium. Drugs that belong to this class include bumetanide ethycyanic acid. The uses of the loop diuretics are they used to treat acute pulmonary edema and the chronic renal failure. They also treat hypertension and hyperkalemia. There are few side effects are also given like hypochromia, hypertenchronia, metabolic alkalosis and magnesium 2 depletion are also given. So this was all my presentation. Thank you for watching.